So I hope that you're enjoying these videos, and I hope they're helping you as much as it helped me, and how much I've enjoyed being able to learn these things and share them with my patients and others who are concerned about these vaccines or just need more information. As you notice at the bottom, you can make comments or ask questions, and I'm happy to answer those as best I can. So as we go into part 3, this is our last segment, and I want to discuss with you the rollout and the availability of the vaccines, and how you may get yours and when, and how those decisions were made, as well as some final thoughts that I've had that are deeply meaningful to me about such a process as we're going through. Now, some people are concerned about privacy and anonymity, and we'll deal with that as well. So the information from the analysis of health issues and personal contacts with the spread of this pandemic shows that the best way to limit the spread and save lives is to first immunize acute clinic, hospital, healthcare workers that deal with the public. And this was well studied through what's called social networking research, which does not mean anything like Facebook or Twitter. It's the way that we track how disease is spread across a population. This was very well studied, and it also suggested that the group that should be immunized right after direct healthcare workers are nursing home patients and the workers in nursing homes, who are also, of course, healthcare workers. Now, we will have to do this in waves because, as you can imagine, you wouldn't want your entire staff being vaccinated at once, or all of your coworkers, and maybe 50% of the people being in bed the following day, and 50% of the people being in bed the day after that, and you having to shut down your operation for a day or two. So we're going to see this done in waves, and I've made up a model that I'm going to recommend for our clinic system, for the health system with which I work. So we expect that if you have 10% that are affected severely, that they may be out for a day. But if you stagger these, we should be able to keep things going while we're gaining immunity against this virus. Also, think about how this vaccine is going to be rolled out, and you may have heard about some of the technology and some of the conditions that are required to keep this virus ready for immunization, so it will give what we call immunogenicity, or it will cause immunity. Now, also realize, because of the way that this is done, that we won't be getting a vaccine anytime soon that can be given in a small town or rural area, or nearly any clinic setting anytime soon. The reason is the extreme cold required to keep the lipid nanoparticles together and to keep the mRNA molecules from unraveling before they're quickly brought to room temperature and injected within 2 to 4 hours after they're thawed. And these vaccines can't be refrozen. They must be kept at the same temperature as the most extreme Antarctic temperatures, that is, from -70 to -80 degrees Celsius. That's -100 degrees Fahrenheit. And the chain of delivery from the pharmaceutical companies to the states to the hospitals must assure that the temperature is in that range. Special 18-wheel trailers have even been transporting the vaccine in deep sea fish containers to keep fish frozen over long distance traveling, as you see in these Thermo King 18-wheeler and shipping containers. And these have been converted for those purposes. So when you get your vaccination, as I hope you're all beginning to consider at least, it will almost surely have to be at a major tertiary medical center like the system that I work for at Baxter Regional in Mountain Home, Arkansas, or these other ones around the state that are involved in the trauma system and tertiary care ICU facility type hospitals. I have no doubt that the excellent marketing, lab, nursing, and administrative teams at Baxter will keep the public well informed about the opportunity to get this vaccination and create optimal availability for the release of this vaccine for the general public after healthcare workers have been vaccinated. Now to our final controversy, and another one of the concerns that many have had regarding anonymity and privacy, after numerous threads on social media have given rise, in some circumstances, to concerns about being tracked with this viral vaccine. You'll note that the military did, in fact, set a contract for $138 million earlier this year with Apogee Systems America to have tracking RFID chips put on the outside of syringes so that they could track when, where, and in what conditions the vaccine was given to our soldiers. This is the only tracking mechanism that I have been able to discover or uncover associated with even the outside of an individual syringe. There are, of necessity, tracking chips on the coolers and the lots to assure proper temperature and quality control as well as delivery, not unlike the tags on clothes to prevent shoplifting, and those used to identify personnel in security settings. These tags, even if powered, will only detect a bearer up to 150 yards. So I think that those who worry about being tracked don't stop to think that it would take some agent, if they were trying to track us, walking around behind us with a suitcase within 150 yards. And I guess then to what purpose would that be unless you're a spy? So remember, too, that it's only on the outside of the syringes, even for the military. It has no personal data and only shows where and when the vaccine was given at the very most. What it seems that most people are actually concerned about is GPS tracking with information and personal data, of which most requires the kind of device that we all carry around in our iPhones, as you see here, this U1 chip inside of an iPhone, or the kind that we wear when we go backpacking or backcountry skiing. Some find it strange that we can be tracked by every internet, Wi-Fi login, every photo we post on Facebook, every time we use maps on our smartphone, each time we use location data when searching a map, every time we download a workout that we've run or biked in the community, each time we turn on our phone even. Not to mention each delivery from Amazon Prime through UPS. I had a patient say, and I really like this lately, they said, I don't care if this vaccine even does have a tracker. I'm not doing anything or going anywhere that I'd be ashamed to be doing or found out going to. So what about the tiniest tracking devices? The technology that minimizes things down to where they could be injected into a human being. Most of this is science fiction, folks. But, now here's James Bond getting his in Casino Royale. The smallest mini GPS trackers are about 8 millimeters long and about 1/4 of a millimeter in diameter. They can be injected into a human and many pets, as you know. Here's one being injected into a volunteer's hand and how it shows up. You can see how sizable that is when it's implanted. And here's the needle required to inject even the smallest one. Now here's the size of the needle that would be required compared to the needles that we use to give COVID-19 mRNA vaccines, and honestly almost every other injection that you get at a doctor's office. Only small grains of sand will go through such a needle. But the filters used to clarify the vaccines after that they're synthesized before they're packaged and then ultimately drawn into sterile syringes are so strict that anything even the size of a single cell will be filtered out. So think, these individual syringes that we randomly pull out, our nurses take out of the injection storage cabinets, would have to have a single theoretical tracking device either already present on it, or if the solution from the company was contaminated somehow with these nano tracking devices that are as small as a grain of sand, there would have to be just enough for each person to get one tracking device suctioned into a random syringe per dose, or however this conspiracy would work, that they would get more than one and some would get none. And that's assuming that they were, it's just amazing to me to think about this. Also, these supposed tracking particles would have to be smaller than grains of sand, and that these would then somehow need to be able to identify and track individuals separately, even though the company nor any agency knows where or when any of the particular doses of this vaccine will be given worldwide. The randomness of this, when you calculate it mathematically, just strains credulity. And one would have to assume that there was a worldwide conspiracy between hundreds of agencies to try to find a way to track people who can't already be tracked when we look at our smartphones 87 times a day on average. With some basic math, the chance of a tracker the size of a grain of sand being individually suctioned into a random syringe and given to a target that could be pre-programmed or triggered somehow for an individual is about the same as someone blindfolded being spun around 4 or 5 times, shooting a rifle randomly into the air, and it landing a mile away in the center of a BB that was scattered out on the ground amongst about 1 million other BBs. Folks, there is no way such can happen. It's impossible. But there are some questions, even though some strain credulity, that are reasonable questions that we just can't answer yet. We just don't know some things for sure until we have more time and more people involved, like long-term sequelae. Now remember that within 7 months at the most, none of the 80,000 mRNA vaccine test subjects have had certain severe sequelae. The long-term protection of a 2-shot vaccine series, we expect to be somewhere between 4, we know, and maybe 14 months from these mRNA vaccines. What about other vaccines? We don't know yet because none have been approved by the FDA for use in the United States. Is there going to need to be an annual vaccination? Are we going to have like a flu vaccine with COVID in it every year? We just don't know. We don't know if this virus is going to mutate like flu vaccines do over the decades. Is the severity of COVID disease going to be less or more in the 1 in 20 people who are vaccinated and still get the infection? Well, I would think that since about 44% of people in multiple studies that get COVID are asymptomatic, I think personally that it's very unlikely the vaccine is going to cause severe or more severe side effects in those who've already been infected than if you just get the vaccine without infection. But we just don't know yet. And we have much data from the survival of the novel H1N1 swine flu of 2009 that showed that older people were protected even though it was a brand new virus. Older people who had lived through the 1957, 1968, and 1975 swine flus had lower death rates than healthy children who had never been exposed to a swine flu virus. So, also, what about if we're immunized, can we stop wearing our goggles and masks and all the other garb that we have to wear and worrying about all of these personal protective equipment restrictions? We just don't know. We're going to have to wait and see how good the immunity is long term and how many people are vaccinated, because we're probably going to have about 2 out of 3 people vaccinated before we can go back to normal. When will this be over? Oh, folks, I wish I knew. But we're just going to have to keep taking it day by day and doing the best we can and be thankful that we live when we live and have access to all of the great technology and information that we can obtain, and how, compared to some of the places that I do mission work, that we have hot running water, that we have vaccinations available, that we have health care and pharmacy right around the corner. I don't know, but let's just be thankful for what we have and make the best use of what's made available to us. So I'm going to, in closing, just make a few personal statements and thoughts that have really been on my mind for the last few days. I hope that what I'm about to say and what I've already said help you make a healthy and a fully informed decision, whatever that is. Also, let me say this. No one is going to make you take the COVID vaccine. We live in a free country still, at least for now. And I cannot imagine a situation in which there's going to be any requirement unless you have a certain type of job and are around certain types of patients, such as people who work in the hospital having to have flu vaccines in certain situations. So just a few thoughts before we close. Firstly, I believe strongly that the risk of COVID-19 infection, as is in other respiratory viral infections, is almost certainly more dangerous and also will cause more complications and sequelae than those of any vaccine that's developed by a multinational, civilian, military, private, public, FDA-approved vaccination for COVID-19. We also all know that we live in a time of great polarization. There's a lot of mistrust, and there's a toxified and often misinforming social media. Based on death rates from people that are more fearful of what might help them that I've seen during COVID than what ultimately causes their harm, I personally believe that the cynical mistrust that we've seen is becoming more dangerous than any vaccine that could possibly be produced by the pharmaceutical and health industry that we have. That is, outside of a centrally controlled communist or socialist government with a health system that was controlled centrally like that in Nazi Germany, the former Soviet Union, Venezuela, or North Korea. Those could have the power to actually do some kind of conspiratorial work, but it's just almost mathematically and just sensibly impossible for that to happen with this current vaccine. Please know that your doctors, nurses, hospitals, state health departments, FDA, CDC, the U.S. military, pharmaceutical companies that have stockholders and legal obligations, who also have stellar track records for producing great products with excellent safety profiles. None of us have any incentive and nothing to gain by harming you. We are not trying to commit malpractice, economic, or lethal suicide by putting out ineffective, harmful products. Finally, let me say with all my heart as a patriot, as a final statement, if it is good enough for our soldiers, it's good enough for me and for my family and for those that I care about. And that is why that I will be one of the first people in line getting this new vaccine and doing so very thankfully. And I thank you for taking the time and attention and interest to learn about these things. If this has benefited you, please forward this to other friends. Please link to it. Please share it with those who need to see it. And get some good, healthy information out there available to people on social media. Please feel free also, as I've stated before, to ask questions or make comments in the area below. And I'll try, as we always do on What's Up Doc, to keep bringing you good information and things that actually serve and help you and bless you. Thanks for your time and attention.